This is a short screencast on atelectasis and lobar collapse as part of the pathology recognition series for the PRP module. Atelectasis is the term used to define a reduction in lung volume, and that can affect an individual alveolus or it can affect a significant proportion of the lung. Now, if you remember the lung volume curve, the lung expansion curve that we referred to in earlier sessions, we talked a bit about the point at which the alveolus expands normally. So we want an alveolus to be nice and compliant, and so you get a big change in volume for very little effort. And the point at which that happens within an alveolus is the point at which is defined as the lower inflection point. Now, atelectasis refers to a reduction in volume. So basically, atelectasis refers to this part of the curve here. Okay, so the reduction in volume through to the complete collapse. And there are different types of atelectasis. There's obstructive atelectasis and there's non-obstructive atelectasis. And the fundamental difference between the two is obstructive atelectasis is where there is something in the way stopping the gas flow getting to the alveoli. So that might be a plug of sputum, for example, blocking an alveolus, and therefore the gas within that alveolus gets absorbed over time, and therefore the alveolus begins to deflate and ultimately collapse. Non-obstructive atelectasis refers to something reducing the alveoli's ability to expand that isn't causing a blockage to flow. So that might be that your chest wall isn't expanding due to either pain or reduction in effort, or there is something that's disrupting the normal pleural membranes, and therefore the chest wall might be moving but the alveoli isn't being drawn open with it. So different forms of atelectasis, and therefore there's different causes of atelectasis. In terms of lobar collapse, as the name suggests, it signifies when there's a specific or defined area of lung tissue that's met its closing volume and hence has collapsed. And that could be something that happens in the acute situation, or it could be quite a chronic or long-standing problem. And ultimately, the implications for physio are whether there's something that we can influence to improve that area of collapse. So it could be a large, fairly central sputum plug that's caused a significant area of lung distal to that to collapse through obstructive atelectasis. It could be post-op, so there's certain surgeries that predispose patients to lobar collapse, so particularly perhaps cardiac surgery, and also if there's been chest wall trauma, if you've got patients with fractured ribs and significant amount of pain, then you're going to get very asymmetrical chest wall movement and reduction in volume in a particular area. So thinking about the cause of the loss of volume and the area of lung it's affecting will help you then identify what you're seeing on clinical presentation, and therefore what you can use within your treatment options to hopefully reverse that.